In order, we'll move to item number 2, consent agenda. All the following items which concern reports and items of routine nature normally approved by AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of the items. Consent agenda consists of discussions, consideration, and actions on the following items. A, the minutes of the special trustee meeting of July 30th, 2024. B, the Finance Committee meeting minutes, August 20th, 2024. And C, the check report, July 9th, 2024 through August 8th, 2024.
Make a motion to approve the consent agenda, items A through C as printed.
Second.
Thank you, Dr. Brown. We've got a motion by Dr. Brown and a second by Dr. Simon to approve the consent agenda. Roll call.
Martin?
Yes.
Bowman?
Yes.
Burke?
Yes.
Simon?
Yes.
Mossberg?
Yes.
Brown?
Yes.
Hannaford?
Yes. Item 3, CEO's report.
Okay, well, we are super excited regarding the Senior Life Solutions program. We've got an office coordinator hired and we've got a therapist hired. Charita McCosker is going to be our therapist, so we're super excited about that. They will join us first of September. They'll start training and we'll open the program mid-October. Between now and then, the staff will start their onboarding and begin providing educational opportunities for the providers so that they can identify candidates for the program so that we can get started. Ambulatory surgical services had a great month in surgery. Amy's working within reach to try to become more efficient, but we're super excited about the schedule and Dr. Roberts and Dr. Tupper's involvement here. The nursing home sale, Beetle has submitted to the State Department of Health for the change of ownership, and historically that process takes about 90 days. So we're about, a week into that? Revenue cycle management, it's been our heavy focus over the last few months. We're pleased with the progress that's being made. Days not final billed for July, drumroll, 2.4. It's never been that low. Our target is actually 6 days, but we were able to get it down to 2.4 days. That is collective efforts of everyone staying on top of those revenue producing departments and getting those things that we need to get those bills out the door in a timely manner. Something I do want to bring up that I got clarification on during one of the meetings. Let's say Kelly's insurance, Kelly comes for a service and he has a procedure done and the insurance company has a question or needs more documentation about what was done, or didn't like the code on that we had used, so needs further clarification. So this goes back and forth between our billing company and the insurance company until they get resolution. And as you can imagine, those things don't happen in a timely manner, on one side or the other, how that can drag out. So once that finally settles with the insurance company, that is when that account then flips to self-pay, and then Kelly will get his statement in the mail for his portion of that. That can be weeks, months.
Some of those contracts, the insurance companies have 90 days to respond and then allow providers another 90 days. We don't take 90 days to get back with them, but you could see how if there's a 90-day allowance there, even if one party wasn't slow, if the insurance company is holding that up, that could turn into 6 months really quick with only 2 communications, so.
It's ridiculous.
It is ridiculous.
To drain on resources. I think it's a way for them to reserve cash, It's the game. So just a little tip there. Anyway, we're making it a priority to stay on top of those accounts and try to get things out in the most timely manner that we have control of. So I think that's being reflected.
No.
Okay.
I want to find something.
Okay.
Say it in a little bit.
Okay. IT, Reese, our IT manager, is working with a company that's going to come out and review our archiving requirements for eClinical and Meditech 6.0. Remember, we moved to Expanse in July of '23. So there's all of this data sitting out there in eClinical, which was our clinical software, and Meditech 6.0, which was 2011 to June 30th of '23. So all of that data is sitting in there, and we've got to do something with it because we are paying maintenance costs, storage costs on all of that. So trying to figure out what the best method forward is, and so Reese is discussing that with a company. Recruiting, we are recruiting for an urgent care provider. The busier we get in there, it's getting harder and harder for our mid-level practitioners to do both their primary care jobs and to cover urgent care. So we do have a locums that's coming in to help. She's been with us for a while. Jessica Hyman from Woodward comes in to help, but we also have another one. What's her name? Kristen Denny, that you're going to approve tonight. Yes, or is it temporary?
She just did.
Oh, I got temporary on her. She's going to start coming to help take some of the load off of them. And I've had one interview. He chose to take a job somewhere else. So we'll continue to look. Department reports. Clinic visits were up for the month for all 3 clinicals over June. The weight loss clinic visits are continuing to increase, and patients are doing well, seeing some good results with those medications. And we're also looking at expanding and enhancing that program with some new medication regimens. Nursing staff will be working with the LPN program out at Northwest Tech, serving as preceptors. We also, I don't know if I've mentioned this before, but we are taking advantage of a program through St. Anthony where we are able to, through telemedicine, get consultations from pulmonology, cardiology, nephrology, and neurology. And we have used a few of those services with good results and experience. We've got some good feedback on that. So we're grateful to be able to have that kind of service here. Radiology looks like they have been busy. We did have the State Board of Pharmacy out for their annual visits, and he said it looks great. No citations were issued. Physical therapy had almost 200 outpatient visits for the month, and we want to congratulate Shannon and Ryan on the birth of their new baby boy. They are doing well. Lab reports a rise in COVID numbers. I'm sure you all have heard that. Not unexpected, especially with school starting back. And Reese continues to work on pricing transparency. It's a new regulation that we have to be in compliance for the federal government. The project is ahead of schedule and should be completed the first half of September. Kudos to Reese and to Mark for doing this. They saved how much? Do you remember?
I don't remember how much, but
Thousands and thousands of dollars. We would have had to go out and buy software from a company to accomplish what they are building themselves. And so we're pretty excited about that. They're a couple of talented guys. I don't have anything. Do you have this graph in yours? Does everybody have the, just kind of flip to the graphs that are got towards the end of my report. Everything in the golden color, the yellow, is 24, what we're looking at now. And you can kind of see where we're comparing to 23. And starting in this year for 25, it's in the green. But you can kind of tell what we did over that fiscal year of 24. It looks like we've made some improvements, some significant improvements in areas in the revenue cycle and improving our cash position. We did once again hit over 2.2 million. I think we were at 2.270. I can't really see on this one, but anyway, we're happy, especially for July. That's good.
Great, so, any questions for Candace? Hearing none, do I have a motion to approve and accept the Share Medical Center written report for August of 2024?
I move to approve the Share Medical Center written report for August 2024.
Second.
Thank you, Dr. Simon. I have a motion by Dr. Simon and a second by Mr. Bowman to approve and accept the Share Medical written report for August 2024. Roll call?
Bowman?
Yes.
Burke?
Yes.
Simon?
Yes.
Mossberg?
Yes.
Brown?
Yes.
Hannaford?
Yes.
Martin?
Yes.
Okay, we'll move on to number 4, CFO's report. A, the statistics report and financial report. Kelly?
Well, Candace shared some of what I would have shared, but with regard to the unbilled being at 2.4 days, yes, that's the lowest. The total at 58.2 is also the lowest we've seen in the last, at least in the last 13 months. I didn't actually go back any further, but I figure if not the lowest ever, it's one of the lowest ever, being the lowest in the last 13 months. So total accounts receivable balance was $3,133,042, and that was a decrease of $304,000 compared to July. Some of that was written off to collection agency, about $213,000, but the vast majority of that was really collections, and so that was good. Accounts payable for July was at 1.5 million, and that's 131 days of operating expenses. Gross revenue was, like Candace said, 2.27. It was slightly, like $3,500 less than June. So, but it was a really, is a good month period, but it's a great July. We did have an increase in clinic days compared to June. Patient days in the hospital were down, however. Contractuals, less bad debt, and charity care was 56% of gross patient revenue. We had $213,000, like I said, written off to a collection agency. Charity care for the month. I'll go back to collection agency. We do not send to the collection agency until a person has received 4 statements and 2 phone calls. And so these are accounts that truly are not collectible, without going to the collection agency. So charity care for July was $86,000, almost $87,000. And we have been, that's actually a good thing when it comes to when we do our cost report. We get credit for doing charity care, and so we don't necessarily mind seeing that, but we do have certain qualifications that patients have to meet before they are able to receive charity care. Operating expenses, not including salaries, benefits, and depreciation, was $439,693. That was down about $167,000 compared to June. Salaries and wages was $578,306, and that was an increase of about $75,000 compared to June. And our net operating income was $291,573, with total net income of $396,026. You can see in the next pages, you can see the 6-month comparison. July is this second highest revenue month since February. It's also the second highest expense month back to February, but we're off to a good start for the fiscal year. And if you go to the 3-year comparison on page 4, you can see that hold on, sorry. Okay. I missed this earlier, but we don't have year-to-date 2025. We've got year-to-date 2024. But if you can look at our comparison of our Julys for 24, 23, and then 2019, to start the year off with a $396,000 net income is significant when we're usually accustomed to starting the year in the hole.
No.
Ever. It's crazy.
I would encourage you so that we've got some other reports back through here. Anytime you get your board packet and go back through maybe some of these reports, the Avidify report is kind of an interesting look. It tells you who's applying for that type of credit in order to be able to pay their bill. The next report is our TrueBridge report, and it kind of goes through a lot of those revenue cycle key performance indicators. And even if you don't understand the numbers, some of them will tell you what the target is, and you can see how we're trending month after month after month. And so we're overall trending favorably, not hitting all of our targets, but we are moving in that direction, and the staff are really taking ownership and starting to get some of these, starting to get some good habits formed, I think. And so hopefully we see some consistency moving forward, and that keeps moving the needle where we want it.
I'll also point out, if you saw the reports, but our 340B revenue is up considerably, almost 80,000 for that month, which is good. And hopefully we'll kind of keep it back up there.
We've got some more drugs that have been qualified. So our first invoice in August was for 80-some thousand on its own. So, it's moving in the right direction, and then in September we'll see more of our providers in those lists as well.
Okay, any questions for Kelly?
I'd like to comment, it looks like everybody's doing a good job at cutting costs and finding ways to reduce the cost everywhere it looks like, so I'd say attaboy on that. If the level of services remaining high, and
I know, the finance committee heard me say it last week, but I couldn't be happier with Kelly and Jaden. They have really jumped in and are doing a fantastic job. Very driven and passionate about what they do. I can't say it enough too. I think Jaden's a lot of help for Kelly, especially having an accounting background. She's able to shed some light on some stuff, but this girl, she's taking contracts and diving into them to see if we're getting what, we were supposed to get what we're paying for. Should we be paying for that? Are we paying too much? Are we even using it? This girl's all about finding money.
And I was gonna say that, not only just besides cutting costs, but they've gone back and found some things where, they've done a good job to find money that we should have got in the first place and have gotten that, so.
And I don't know that we had this completed yet last month whenever we met, but we did sign a renewal contract with Blue Cross. We're going to probably see about a $18,000 a month increase in Blue Cross payments, just based on if they continue to have the same number of visits and whatnot with claims with us. And we'll see that this year, it's a 5.5% increase, and next year it'll be a 5.5% increase over this year. So that's good. Today I just signed a new contract with United Healthcare, and we're going to see some increases there. Probably going to, I think it's going to triple what they had been paying for an acute care night. And it's also setting up our emergency department to, they were just giving us a flat, low flat, fee.
They lowballed it. We actually had recently a case where a patient had got a very expensive drug, and Kelly was able to have that conversation and say, no, we're not going to accept that. Here's what happened. You paid us $1,200. The drug alone cost $18,000.
Life-saving drug.
Life-saving drug, $18,000. We can't do that. So they actually went back and paid, they actually wrote in the contract a special clause for situations like that, and they'll go back and pay on that.
And yeah, we're turning over stone. Jaden is doing a great job. In fact, this next item on the agenda is Jaden's work. So.
Okay, any questions? We'll move on to letter B, discussion and action to approve the purchase. And I wanted to tell the board, as of just before the start of the meeting, there is only one option, that's option A. So discussion and action to approve the purchase of a refurbished 1,000 gallon bulk liquid oxygen tank and vaporizer from Munn Supply at a cost of $36,200. Kelly or Candace, do you want to?
Yeah, I can. So one of the contracts we were looking at was with our bulk oxygen, and we have, it's the big tank that sits out back, not the biggest tank that sits out there, but it's the smaller of the big tanks that sit out back behind the hospital, and it provides our medical air, oxygen. The contract we have presently is increasing in price September 1st, and we would be, if we stay with that contract over the next 12 months, we'll spend about $55,000. And over the next 18 months, we'll spend about $82,000. If we buy this tank from Munn Supply, and then Munn Supply begins providing our oxygen, our bulk oxygen and whatnot, we will do away with our rental costs, and our next 12 months with Munn Supply will be about $60,600. But our next 18 months would be about $64,000, it's almost $65,000. So it's about a $17,000 savings over the next 18 months if we can purchase this tank.
And we own the tank. And we own the tank.
And we own the tank. The reason option B came off the table is because the other company is not interested in selling tanks. They just rent. At that, I think it makes sense for us to go ahead and purchase that tank. That'd be my recommendation. And it's $35,200 for the tank.
Any questions?
What sort of maintenance are we obligated to do for owning versus renting?
It's really zero maintenance, but our oxygen supplier will take care of that. Those tanks, there's nothing that can go wrong with. It's a tank. I mean, it doesn't do much. Our lines and stuff, we still have to have.
That's on us, anyway.
Yeah.
Any other questions? Hearing none, do I have a motion?
I'll make a motion to authorize the hospital to buy the $1,000-gallon bulk liquid oxygen tank and vaporizer from Munn Supply at a cost of $35,200.
Thank you, Mr. Bowman. Do I have a second?
Second.
Thank you, Dr. Brown. I have a motion by Mr. Bowman, a second by Dr. Brown, to purchase a refurbished 1,000-gallon bulk liquid oxygen tank and vaporizer from Munn Supply at a cost of $35,200. Any other questions? Roll call?
Burke,
Yes.
Simon,
Yes.
Mossberg,
Yes.
Brown,
Yes.
Hannaford,
Yes.
Martin,
Yes.
Bowman.
Yes.
Okay. Item 5, Dr. Burke, Medical Staff Executive Committee.
Okay, Medical Staff Executive Committee met on August 15th, 2024. And there's 2 items to bring to the board from Credentialing Committee. The first one is appointment to courtesy staff, Sharita McCosker, LPC Behavioral Health. She'll be the counselor therapist for Seniors Life Solutions.
Is that a motion by? Is that a motion from you?
It can be.
Yeah, from the committee. Okay. I have a motion by Dr. Burke.
Second.
Thank you, Dr. Brown. I have a motion by Dr. Burke, now a second from Dr. Brown to appoint to courtesy staff Sharita McCosker, LPC Behavioral Health. Roll call?
Simon,
Yes.
Mossberg,
Yes.
Brown,
Yes.
Hannaford,
Yes.
Martin,
Yes.
Bowman,
Yes.
Burke.
Yes. The second one is reappointment to allied staff, Sean Frendenberg, PAC Emergency Medicine. How long has he been here? 2 years? Does an excellent job. I would like to make a motion
Okay.
Second.
for reappointment.
I have a motion by Dr. Burke, I have a second by Dr. Simon to reappoint to allied staff Sean Vredenberg, PAC Emergency Medicine. Roll call?
Mossberg,
Yes.
Brown,
Yes.
Hannaford,
Yes.
Martin,
Yes.
Bowman,
Yes.
Burke,
Yes,
Simon.
Yes.
that's all I have.
Thank you very much, Dr. Burke. Item 6, Quappy. Candace, anything you want to cover?
Nothing in particular, unless anybody had any questions.
Any questions on Quappy? Hearing none, we'll move to item 7, improvement to patient care. Candace?
There are 2 items on there in red. Those have been assigned. We're trying to go through these and assign them to the owners, actually, so they're reading those contracts themselves. And it looks like Kelsey had not got to a couple of those, but they are queued up for her to review. So our compliance average was 83.3%. The rest of them were 100%. Look good.
Okay. Any questions for Candace on the evaluation of contracts? Next.
I'll say both of those were still in process at the end of the month.
Yeah.
One of the ones I was talking about earlier.
Okay, letter B, we've got discussion and action to approve or disapprove the revisions report dated July 31st, 2024.
And the revisions report, you will note in column 4, the final review remarks, those are the changes, or just updates that are noted, so you can flip through there and see if there's anything in particular you want to discuss.
Any questions?
Mrs. Simon, would you like to
Funny comments?
bring
or-
something?
Yeah, they have written right here that they corrected the grammar errors.
The grammar.
Grammar is spelled wrong.
The
That just
very
made me laugh.
first one.
I made me laugh a little bit.
Act like you're an English teacher.
God.
Do I hear a motion to approve the revision report dated July 31st, 2024?
I move that we approve such report.
Second.
Thank you, Dr. Brown. Thank you, Dr. Simon. A motion by Dr. Brown, a second by Dr. Simon to approve the revision report dated July 31st, 2024. Roll call?
Brown,
Yes.
Hannaford,
Yes.
Martin,
Yes.
Bowman,
Yes.
Burke,
Yes.
Simon.
Yes.
Mossberg.
Yes.
Time out. I have to say, even when I put a comment on Facebook, I find myself editing it because I'm afraid Mrs. Simon's gonna see it. Like, seriously.
I don't correct people. That was
No,
just
I know
funny.
you won't, but you will in your mind.
Well, that was just funny because it said corrected our grammar errors.
Why? That hurt, didn't it?
Okay, letter C, approval or disapproval of the Senior Life Solutions Outpatient Hospital Psychiatric Services Policies and Procedures Manual.
I have a copy if anybody would like to look at it.
I make a motion that we approve the Senior Life Solutions Outpatient Hospital Psychiatric Service Policy and Procedures Manual.
Thank you, Dr. Brown. Do I have a second?
Second.
Thank you, Mr. Bowman. I have a motion by Dr. Brown, a second by Mr. Brown, or Mr. Bowman, to approve the Senior Life Solutions Outpatient Hospital Psychiatric Services Policy and Procedures Manual. Roll call?
Hannaford,
Yes.
Martin,
Yes.
Bowman,
Yes.
Burke,
Yes.
Simon.
Yes.
Mossberg.
Yes.
Brown.
Yes.
8, Sheriff Convalescent.
Like Candace mentioned, the sale proceedings are proceeding. And so I do know that state surveyors arrived today to do annual surveys. So that was, it's always unannounced. And so, but the staff over, I haven't been over today to check on them. I talked to Adam earlier today, and so far things were going well with the survey. So they'll have, probably an outcome of the survey here in a few days, and probably something to share with you next month. We had a issue with the chiller that's been repaired, and then a subsequent, last week was a bad week for maintenance. Brian probably worked 700 hours last week, and I do want to give a big shout out to him, not just for the nursing home work, but the hospital. Him, Damon, Jeff, all of them, they had a lot of things happen last week, but they handled it well, got everything taken care of, and anyway, part of that was with the chiller and then the cooling tower at the nursing home. The cooling tower ended up getting a busted water line about, 5 foot underground, and it wasn't a place where you could get equipment in, so they hand dug it. We were able to, and I appreciate the folks out at Bill Johnson's. They came out and let the guys have a break from the shovels, and they filled the hole in. So, but everything was on the mend over there with the HVAC system. So we appreciated everybody's work, the volunteers and the staff. The finances, cash balance for July was $386,637. Accounts receivable was $974,000. That did come down from, as compared to June, by about $65,000. Our gross days, AR, increased slightly from 80.2 to 80.6, so basically flat. Accounts payable balance was $138,000. Gross revenue was $242,000, and that was a $16,732 increase compared to June. Total patient days in July were up compared to June. Operating expenses excluding salary, benefits, and depreciation was $172,246. This was a $28,000 increase compared to the previous month. And salaries had about a $4,200 decrease, and totaled $87,386. The net operating loss was $48.51, and the total loss was $4,449. You can see the next page is a 6-month comparison. We've had months with net income, and we've had months with net loss, but as far as the net loss is concerned, it's not a huge loss for the month of July. When you flip back to the 2-year comparison, it's significant improvement over July of 2023, which we lost $63,701. So about almost a $60,000 improvement versus last year. Any questions on the nursing home?
Any questions? Okay, move on to the homestead report.
Homestead, Tony's been showing a lot of apartments and renting a lot of apartments. So they did get the elevator fixed since our last meeting, and that was celebrated. They were all very happy about that. And but they've had, I don't have it handy, but they've had several new residents move in the month of July and in the first part of August, with more people continuing to look at apartments interested in moving. So that's good. July's revenue was $62,669. Expenses were $62,677. So basically break even. They lost $8. I'll give them $8. They can break even. But pretty, decent month. Didn't lose anything. Didn't make anything. But they're having a lot of activity. Year over year, it's about the revenue from July of 2023 was kind of, it's misleading. In July last year, there was a county correction from June that trickled into or impacted the July numbers, so it's not a good comparison, but those numbers are still there for you to see.
Any questions for Kelly on homestead? Any foundation report?
No, sir.
No St. Anthony's reports?
No.
Okay, Greg City Council report.
Oh boy. Okay, we had a pretty extensive meeting this last week. We entered into a contract with Waste Connections for our citywide trash pickup. I will say it's just a contract to pick up the trash. There's a lot of things we still have to work on. As far as the transfer station, the folks that have trouble getting their barrels out. And anyway, that'll be ongoing. That's coming up in January, or shooting for January. We had an employee recognition of Grant Taylor, which I think the hospital was part of, and very deserving. His quick action saved this child's life, I believe, what you read. So thank you to Share and Life Flight and Alva Fire Department. We got some good folks. We completed the 23 audit that came out well. We also entered into an agreement with Woods County to build a brand new senior citizen center, I believe on the north-southeast corner of where the old armory is.
The old armory,
yeah, double old. We contracted with a firm to do the curbing on the Locust Street project, so that should be finishing up here real quick. And we contracted with a company, Retail Economics. It's a development consultation company that I think is going to do our community really well. Visiting with these folks, they want some committees or a committee formed out of the community to talk about what they feel the needs are of the community. It wasn't just bringing in a Dunkin' Donuts or a Brahms or anything else. They talked a lot about quality of life things. So I think that's going to be a good deal. Anyway, that's about it.
Okay, any questions for Mr. Bowman? Thank you, sir. I made comments earlier about just the progress that we're seeing, so other than that, there's no chairman's report. Any new business? Okay, hearing none. We are adjourned. Have a great evening.